Well, good morning. How are you doing
Good
today?
morning. I'm doing good. How are you doing?
I'm doing well. My name's Abby. I am a nursing student at John Brown University, and I'm just going to be running through your health history form that you filled out, okay?
Okay, awesome.
Great. Can you just start with your full name and date of birth, please?
Okay, Shannon Von Stroh, and then date of birth is September 6th, 1994.
Perfect. So I see that you're 22.
Mhm.
I see that your presenting problem today is you've been experiencing fainting spells, and it's normally when you're in the heat, right?
Yeah.
Okay, so can you expand on that a little more? Tell me, like, maybe what you think causes it, or
Yeah.
any aggravating factors.
Yeah, it's been happening since freshman year of high school.
Okay.
Pretty much, and it can happen. It's usually related to sunlight or
Okay.
heat, or like getting out of hot tubs,
Okay.
being outside. Even if it's like only like a few minutes, it can be
Mhm.
really quick. Just or I feel like a plethora of things. I mean, getting up too fast, but I feel like that's like normal.
Okay, yeah.
Roller coasters.
So you just feel like you're gonna pass out. Do you ever faint, or is it?
Yeah, sometimes I actually faint, and
Okay.
sometimes I get dizzy, and I start getting like lightheaded, and then I like lose my hearing and my vision.
Oh, wow. Okay.
And so sometimes if I just like lose my hearing and my vision, I'll sit down and things will be black for a little bit. But
Okay.
then
They
once I
get
start
better though when
getting-
you sit down.
Yeah,
Okay.
once I get water and stuff,
Okay.
it'll like clear up and I
Okay.
can see again, and then I'll start being able to hear things again. And then
Okay.
sometimes I fall and like actually faint.
Wow. Okay.
So it just depends.
Okay. And I see here that you have no history of present illnesses, so I'm assuming this hasn't been diagnosed, or you haven't been checked up on it before. Okay.
I mean, I've told doctors before when it was at the very beginning of it, but
Sure.
then I just like didn't really follow
Yeah.
up with it.
Okay. Okay. So we'll make note of that. I see you're not taking any medications. You have no allergies. Your medical history in your childhood, you mostly just said fevers, ear infections, or bronchitis, throat infections.
Just normal kid stuff.
Yeah. And as an adult now, you still occasionally get the flu, infections, strep throat, and things like that. Okay. You've had no surgeries, and you have not gone to the OBGYN before. No. Okay. And you have no history of diagnosis with any mental illnesses or depression or anything like that. Okay. I see your current vaccinations. Your last flu shot was 2013. Your hepatitis B was 2013. Your tetanus was 2013. And you've never gotten chickenpox vaccination before. Or your, and you don't remember when you had your mumps, rubella, and measles shot. Okay. No problem. Okay, so in your family history, you mentioned that your grandfather on your father's side had a stroke and several heart attacks. He has cholesterol and high blood pressure. Is that correct? Okay. And your mother, or your grandmother on your father's side, had a history of lung cancer. Okay. And then your mother and sister have depression, or have they? Okay. They have had it. Okay, gotcha. It doesn't look like you present with any social history of hypertension or diabetes or anything like that. No depression, alcoholism, thyroid, or renal diseases. You were born in Dallas, right? Okay. And you're a college student. You live with your two parents and you have two sisters, right?
Yes.
Okay.
Well, and I live in college.
Right.
Yeah, when I'm home.
But whenever you're home, that's them. Okay. I see your interests and hobbies are dancing, drawing, and reading. Great. Okay. Looks like for concerning symptoms in general for your weight, weakness, fatigue, and fevers, you said there are no changes in weight, but there has been weight loss because you just don't eat as much food, I guess, if you're on the go or something. Is that what you were trying to say?
I think I just said because of the Whole30 I did.
Oh, right. Okay.
Okay.
That makes sense. Okay. And fatigue and weakness, would that just be due to school and stuff, or is there any relating factors? Okay, perfect.
Or like when I get dizzy, I get weak and stuff like that.
Perfect. No skin problems, you say. You said you occasionally get your dizziness with headache.
Yeah.
Is that with The
Yeah.
fainting spells and stuff?
Yeah,
Okay.
usually after I faint or black out, I most all the time have a headache like
Perfect.
after it.
Right. Okay. I understand. And you said you lose, for eyes, you lose your vision when the dizziness occurs, or you say blurred vision with dizziness,
Mm-hmm.
something like that. Okay.
Yeah.
So you just kind of lose sight.
Yeah, losing
Okay.
sight.
Okay. And as well as you lose hearing
Mhm.
when the dizziness occurs. Okay. You deny any earaches or discharge or ear infections
Right.
now. Okay. No abnormalities with your nose, you said. No problems with your throat. But you said your last dental examination was this last summer, right?
Yes.
Okay. No abnormalities in your neck with swollen glands or lymph nodes. No lumps in the breasts or anything like that. Okay. Pulmonary, looks like you don't have any problems with coughing or wheezing or nothing like
No.
that. No, okay. You say that occasionally or more recently, it looks like you've had more shortness of breath and chest pain.
Oh, yeah.
Yeah.
Yes.
Okay. Yeah. So is that still occurring or
It's only a little bit. It's not
Okay.
something I'm super worried
not something
about.
you're
Just
okay?
I think that should
That's
be
good.
good.
Yeah. Just take a note for.
Yes.
You said the only thing your appetite has really changed from is that Whole30 that you were on.
Yes.
Okay, but no other problems.
Yes.
You say no urine problems. That's good. No problems with that. You're not on birth control or anything.
No.
And you said your last menstrual period was November 1st, right?
Yes.
Okay.
I believe so.
Okay, great. But no soreness during your period or anything like that? Right, okay. No history of blood clots or varicose veins. It looks like you said no. You said no muscle or joint pain. You said that for neurological you experience that weakness due to your fainting. Sometimes your body tingles or body shakes more due to it.
Yes.
Okay.
Yes.
So is that before you get the fainting spell?
So usually before I can feel it coming on. And
Okay.
then,
So you kind of know
after-
it's happening.
Yeah.
Okay.
Yeah. It's usually I start feeling really lightheaded and
Okay.
my vision starts to kind of close in
Sure.
before it goes completely black.
Okay.
And so then my body will
Your
it
body will.
feels really weak, or sometimes it'll feel tingly.
Right.
So yeah.
Okay. Okay. Thank you. You said you easily bruise and that you have low iron.
Yes.
Is that right? Okay.
Mm-hmm.
Okay. So is that low iron something you were diagnosed with, or is that just something you?
I'm pretty sure that's what the fainting's from. Is what I assume.
Okay. Okay.
Because whenever I try to get blood, I usually can't because I don't have enough
Oh,
iron.
they say you don't have enough iron. Okay.
And so I figured that I probably have anemia, and so that's why I've never really
Okay.
gone to the doctor about my fainting. Is where I think it's that. But
Okay.
I don't know.
Okay. Okay. We'll get that checked for you. And I see you have just a heat intolerance because of the fainting spells. But no problem. Do you sweat a lot whenever that happens, or
Not
is
really.
it no? Okay. So no other problems with no glove or shoe size change or sort of anything like that. Okay. And there's no nervousness or anxiety or depression going on, nothing like that. Great. Okay. Well, that completes our first portion of the health assessment.
Awesome.
I
Thank you
appreciate it so much. It was great meeting you.
Yeah,
Good morning. How are you doing today?
I'm doing good. How are you
I'm
doing?
great. My name's Abby. I'm a nursing student at John Brown University, and I'm going to be doing your physical assessment today, okay?
Okay, awesome.
Yeah. Can you give me your full name and date of birth?
Shannon Von Stroh, and then date of birth is September 6th, 1994.
Awesome. Thanks so much. Okay, so with general observations, I can tell that the patient appears to be in good health. She's 22 years old. Her level of consciousness, she's alert and oriented to person, place, and time, and I could tell that by the way she came in and spoke to me and told me her full name and date of birth. Her skin color looks nice and pink, and it's appropriate for her ethnicity. Her nutritional status looks nice and healthy. I don't notice any signs of malnourishment. Her posture and position is erect, and I can tell she's able to change positions easily by the way she kind of crosses her legs and everything like that. There are no obvious abnormalities or deformities noted. I noticed that whenever she came in the room, her gait was steady and independent. She uses no assistive devices for walking. And now I'm going to test her range of motions for all of her extremities. Okay, so I'm just going to have you stand up really quick. All right, and just kind of move your arms in circles like this. Perfect. And then I'll make you kind of move your legs around like this. Perfect. Okay, you got to see that on the exam table. Awesome. So I could tell at that time that she had a complete range of motion of all of her extremities and no involuntary movements were noted. Her facial expressions are appropriate for the situation. She has a very pleasant, cooperative mood with an appropriate expression to our situation in this exam. I can tell by the way that she was responding to me that her speech is clear and able to articulate her thoughts into her native language of English. Her speech patterns seem to have no hesitancy, and her hearing seems to be intact as I asked her a question, and I will further assess that once I do the whisper test a little later on. Her personal hygiene seems to be very good. No body odor or hygiene neglected noted. Clean clothes, clean shoes, clean looking hair. So her personal hygiene is very good. Okay, Ms. Bonstro, I'm going to be starting your vitals now, okay? So I already noted that her weight is 131 pounds and her height was 5 feet and 8.5 inches. Okay, so what I'm going to start with now is taking your radial pulse. So what I'm going to be doing is just feeling for a nice pulse here. Okay, so your pulse rate was 60 and her respirations were 18. So I will make note of that right here. Her pulse was equal and regular with no bounding, and her respirations were even and non-labored breath sounds. And now I'm going to be taking your blood pressure. You want to maybe kind of slide over here, and then I can pull this. Perfect. Okay, blood pressure is 103/65. That's great. Yes, nice and healthy. I'm just going to make note of that here. Okay, and next I'm going to be moving on to temperature. Okay, so here's your temperature. Mm-hmm. Okay, 98.6. Right on. Perfect. experiencing any pain today? You need to be aware of. No? Okay. So if you were to rate pain on a scale of 0 to 10, it would be a 0.
Yeah.
Awesome. Okay, so now we're going to be moving on to skin.
Okay.
And I'm going to just be assessing your hands and your nails really quick here. You can recognize that there's no lumps or lesions. Her nail beds are nice and pink, and capillary refill is less than 2 seconds. The color and pigmentation of her skin is pink with even distribution of pigmentation. Temperature, she has nice, warm, moist skin. Her texture is smooth with no rashes or no masses detected. Her skin turgor is elastic, no tinting, and no lesions are present. Awesome. Okay, now we're going to be doing your head and your face. And I can tell just by looking at her scalp that she has nice washed hair, smooth with no lesions or dandruff. The cranium is nice and symmetrical with no dents or bumps or anything like that. I could tell that whenever she walked in the room, her cranial nerve 7 was intact because she was able to smile and open and close her eyes and pronunciate words well, so her labial speech was intact. And I'm just going to be feeling for your temporal artery. Very nice. Okay, now I'm going to be testing for your temporomandibular joint, so I'm just going to have you to open and close your mouth as wide as you can. Perfect. And no popping or no tenderness or anything like that. Perfect. Okay. Now I'm just going to be feeling for some of your sinuses. There's no swelling or tenderness that I'm feeling, which is good. Okay. And now we'll be testing her eyes on the Snellen chart over here. So take this. Okay. So I'm going to have her stand 20 feet from the Snellen chart. Which is right there. Perfect. Okay. And I'm going to have you cover one eye and read the smallest line you can on the chart for me.
Okay. F D P L T C E O.
Awesome. Okay. And switch eyes.
Wait, lower your clipboard just a little bit.
Oh, excuse me.
No, you're good. F D F L T G E O.
Perfect.
That was the same line, 10.
Great. That was wonderful. Okay, so she was able to read the eye chart with 20/13 vision on both eyes while wearing no corrective lenses or contacts, which is a great sign. I'm very proud. Okay. It's 13.
Oh, really?
Yeah, it really is. So you're doing great. Okay, so there were no involuntary eye muscles that were indicated. Now I'm just going to be testing for your pupil dilation and symmetry and everything like that. Okay, so I'm just going to have you look straight at my face and I'm just going to shine this light in your eyes, okay? Good job. Okay, now I'm going to be testing for accommodation. So whenever I shine this light in your eyes, I'm going to have you look at the light and then look at the wall behind me, okay?
Okay.
Sorry. No, you're good. That's great. That was perfect. Okay, so her corneal light reflex shows light reflection, which is equal to each pupil. She was able to demonstrate proper movement of eyes. And I'm going to now test your 6 fields of gaze. So I'm just going to have you follow my fingers, okay? Here, side to side, then up and down. Perfect. So her cardinal positions of gaze are intact. Her pupils were equal, round, reactive to light and accommodation. I can see that her conjunctiva here is nice, pink, and moist. No swelling. Sclera is white with no yellowing. And her corneas are intact with no swelling. Okay, so the ophthalmoscope here is what we would use to test the inside of the patient's eye and the structures, internal structures of the eyeball. So we would simply just use this light and turn it on. There's different ranges of light that you can use to test pupils and reaction to light and everything. So that's also what we could do. Okay, now we're going to just be assessing your ears. No abnormalities or lesions are present on the ears. Do you feel any tenderness whenever I palpate tenderness with palpation. The purpose of the otoscope for hearing is you clip one of these adjustable cones on the end of this scope here, and it allows you to look into the internal structures of the ear. Okay. So now I'm going to be testing your hearing. What I'm simply going to do is whisper something in your ear. I'm going to have you close the other ear. So close this ear with that hand. I'm going to whisper something in your ear, and you're just going to repeat back to me what you heard. Okay?
I'm so excited for Thanksgiving break.
Perfect. Okay, now close your other ear, and I'm going to whisper something different.
Oh no, my hearing must be worse. I am only doing this assessment right now.
Close. I probably mumbled my words, but yeah, I am loving doing this assessment right
Loving,
now. Yeah,
only
so
loving.
that's okay. I probably mumbled my words a little bit, so that's perfect. Okay. The Weber and the Rhines test. So one to be used with the tuning fork to detect hearing, strength and loss during air conduction and bone conduction by striking a fork, and it creates a vibrational sound that can be heard with the ear structures. So that's what we would use to detect or to use the Weber and Rhines test. The external nose, it's nice and symmetrical. The septum is in the midline. There's no excessive drainage, no tenderness, any sort of tenderness in here. Nope. No swelling is indicated, no septum deviation noted. Okay, what I'm going to have you do now is to test your patency of nostrils. I'm just going to have you include one of your nostrils right here and just breathe in and out for me. Okay, and now do the other side. Perfect. So, able to demonstrate patency to each nostril by breathing while covering the other nostril. Great sign. Okay, now I'm just going to be checking your mouth and your throat. You can just open wide for me. Nice pink mucus moist membranes. Looks like her tonsils are, say perfect. Tonsils are looking nice and symmetrical.
Are they in there?
They are, I see them.
I've never been able to see it. My friends thought I didn't have them.
No,
Good
I
to
can see
know.
them. That's great. No, they look
Beautiful.
Teeth present with no loss or cracked teeth. They're nice, pretty, and white. And when was your last dental exam?
Probably too long ago. I don't know.
Okay, no problem. I think you said in your interview yesterday it was over the summer. Do you recall that?
Yeah,
Yeah?
probably.
Okay.
Is this first semester? Let's see. Yeah. So
This
probably
summer?
over the summer.
Perfect. Okay. So, like I said, her buccal mucosa is with no lesions or discoloration or lumps. Her tongue is the tongue is symmetrical with no lumps or masses. Can you stick it out for me? Perfect. Looking nice, pink and moist. Like I said, her tonsils are present with no swelling or discoloration noted. I'm going to have you just swallow for me, and I'm going to have you try. Open your mouth now. Perfect. Okay, maybe say Perfect. Okay. So I'm checking your uvula. It rises and falls with voice and is symmetrical. Pink and moist with no discoloration. Okay, now I'm going to be testing cranial nerve 12. So I'm just going to have you stick your tongue out and move it from side to side. Perfect. So able to stick tongue straight out, lift upward. Perfect. Pink and moist, no discoloration or atrophy noted. Okay, now I'm going to be assessing your neck. So I'm just going to be feeling for any sort of lumps. Okay. So neck is symmetrical with no lumps, enlargements, or vein pulsations noted. Perfect. And I'm just going to be feeling for your cervical lymph nodes. So here would be her maxillary lymph nodes, and I'm not feeling any no tenderness there, no swelling. This would be her submandibular. I'm not feeling any sort of swelling there either. And then her anterior and posterior cervical nodes. I'm feeling no swelling either. Perfect. Okay, so now I'm just going to be checking your carotid pulse, which is going to be right here. So I'll check both sides. Great, nice strong pulse, 2+. And nice strong pulse, 2+. Bilaterally, no bruits noted. Your trachea is observed is on the midline of the body. And I'm going to palpate and just feel your thyroid gland. So I'm just going to stand behind you, and I'm just going to palpate. No tenderness? Okay. No swelling or abnormalities of the thyroid checking for chest and lungs. So what I'm going to have you do is, I'm going to move this table up. We got it worked out. Okay, and I'll just have you lean back here for me. Okay. So, are you okay if I? Okay, so for sure. Just listen to some noises. Perfect. Thank you very much. Okay. I'll first have you sit up for me real quick. Yeah, perfect. Okay, this is just so I can assess both sides. Okay, first. Okay, take a nice deep breath for me. Okay. Wonderful. Perfect. Okay, now I'm going to go up to your back. Just listen to your. So breath sounds are clear, posterior, anteriorly, bilaterally. You can see that her chest here is nice and smooth. It is symmetrical with no dryness, no tenderness or lumps noted, and expansion of her chest is symmetrical whenever she breathes. Okay, so now I'm going to have you sit up one more time. Sorry. Oh, no, you're good. Going to see her spinous process right here. Looks like it is midline with no bulging or lateral curvature noted. So that's very good. Okay. Now I'm going to be percussing your kidneys. So what I'm simply going to do is just lift your shirt a little bit. I'm going to place my hand at a costovertebral angle. And I'm going to just strike it. Is there any tenderness noted? No. Okay. I'm just going to do the other side. Any tenderness? Perfect. Okay, so no tenderness noted with the CVA. Like I said, the sounds were clear bilaterally, and no adventitious sounds, no wheezing or crackles, no bronchi. So your breath sounds are nice and healthy. Okay, now we're going to be doing the anterior, which was respirations. They were even and unlabored. The skin of anterior chest was smooth, warm, and dry. There were no lumps or tenderness palpated. The breath sounds, once again, were clear bilaterally. No adventitious sounds noted throughout the lung fields. Now I'm going to be doing some upper extremity range of motion. So I'll have you stand up again for me. We'll just do a few more techniques, raising your arms like this and lifting your legs. Perfect. Okay, and now I'm going to have you just grip my fingers as hard as you can. Perfect. I'll have you sit up on the exam table and just push down on my feet. Ooh, there we go. Sorry. That was good. Nice and strong. Okay, so good muscle strength and movement bilaterally. And I'm going to be testing your epitrochlear node, which is just going to be on the inside of your arm here. Okay, no tenderness there.
Slightly.
A little tenderness?
A little bit, but
Okay. Is it painful or just?
it's probably fine.
I just want to make sure it's not hurting at all. Okay, but I don't indicate any swelling or abnormalities, so okay. Sounds good. Okay, so if I were to examine her breast or her axilla, what I would do is lay her down in a supine position. Starting with the axillary tail area of the breast tissue, I would palpate in a straight line downward and upward, downward and upward, and downward across the breast tissue. Then I would palpate around the nipple and the areola to distinguish between the fat and breast tissue for tenderness, lumps, or any sort of abnormalities. Okay, so now I'm just going to be checking your neck vessels here. Perfect. The jugular vein looks like it's not protruding. There is no jugular vein distension noted bilaterally. The jugular vein is not visible or palpated, which is a good sign. Okay. Now what I'm going to have you do is lean you back a little further. Okay. And just lay down. What I'm going to be doing is testing pulsations for the precordium. So the way that I'm going to do this is just be listening to some heart sounds at first. Make sure everything sounds nice and clear. Okay, precordium pulsations. No pulsations were noted with the assessment. 8 to man was nice and strong heartbeat. S1 and S2 were audible with auscultation and no S3 or S4 murmurs or any other abnormal noises. And now I'm going to be checking for your apical pulse. Okay, so now I'm going to be testing your PMI, which is your point of maximal impulse. I noticed that her apical pulse was clear and easily auscultated. So now I'm going to just be listening for this strongest impulse your heart has. Okay, so I indicated that her PMI was located at the 5th intercostal space, mid-clavicular line. Okay, wonderful. I'm sorry. I'm listening for your apical rate and rhythm. I'm going to take note of it on here. Which will just be right here. Perfect. Your apical pulse rate was 60 rates a minute with regular rhythm. Wonderful. Okay, now I'm just going to be assessing your abdomen here. I'm going to lift up your shirt if that's okay. Okay, so nice warm, sorry my hands are cold. Nice warm stomach. Smooth contour with even symmetry and no bulges present. What I'm going to be doing is I'm first going to auscultate and just listen for some bowel movements, and then I'm going to palpate just to make sure there's no tenderness or anything, okay? Perfect. Perfect. Bowel movements were audible ×4. You hear them in every quadrant, which is wonderful. And I'm just going to palpate and make sure there's no tenderness noted in your abdomen, okay? And just let me know. Sorry. No So no tenderness noted in each of the 4 quadrants. Perfect. The light, yeah, so no tenderness or lumps or masses detected with light and deep palpation to all 4 quadrants. Has active non-hyper bowel sounds present in all 4 quadrants. No bruits were detected upon auscultation or no thrills assessed either. I'm not going to assess the inguinal area, but the way I would do that is feeling for the femoral pulse, which is right in this area, right between the hip and the thigh here. I'm sorry, I won't touch anything. The inguinal nodes are in the same area, so I would just be detecting for any swelling or tenderness noted there. Okay, you can sit up for me now and put your feet down. Perfect. Okay, I will lift this up. Okay, and now I'm going to be checking for lower extremities. Just a symmetry, nice smooth skin, symmetrical contour bilaterally, no lesions present, no abnormalities detected here. Has even hair distribution. What I'm now going to be doing is feeling for her pulses and her popliteal, her posterior tibialis, right beside her ankle here, and then her dorsalis pedis, which is right on top of her foot. So, I will start with your popliteal. Might have you scoot a little more over the edge. So yeah, perfect. Now I'm going to go down here to your dorsalis pedis. I'm going to slip your shoes off. Thank you. There we go. Okay. Now I'm going to be feeling for your posterior tibialis. Wonderful. Okay. So I noticed that her pulses were palpable 2+. 2 popliteal, her dorsalis pedis, and her posterior tibial. Notice that the temperature of her skin was warm with no coolness to extremities. No edema noted with palpation, and no warm cracking or dryness of the skin, no lumps or lesions indicated, and her capillary refill of her toes is less than 2 seconds. Perfect. Okay. So now some range of motion with your ankles and feet. Just going to have you move them around in circles, up and down, side to side. Perfect. Has good range of motion of ankles and feet with good muscle strength, demonstrated with resistance earlier. So just push again on my hand for me. Perfect. Awesome. Okay. Now what we're going to be moving on to is neurological. So I'm simply going to do a sensation test. What I'm going to have you do is close your eyes, and I'm going to apply one of these textures to your face, to your arms, to your feet, hands, and legs, and you just tell me what sensation you feel. It should either be a soft sensation or a sharper sensation. Okay. So if you want to close your eyes for me. Soft. Great. Sharp. Okay. Take your hand here. Sharp. Okay. Take the other hand here. So she was able to decipher sharp and soft sensations, equal strength bilaterally, to her arms, hands, legs, feet, face, all the rest. Okay, so now I'm going to be testing your position sense. So I'm just going to have you stand up for me. I'm going to have you close your eyes. Just see if you can touch your finger to your nose. Okay, you can put it down and touch your other finger to your nose. Okay, touch your two fingers together. Touch your finger to your foot. And your finger to your other foot. Perfect. Now touch that finger to the opposite foot. And the other finger to the opposite foot. Wonderful. Okay, so there I was able to detect, she was able to sense and detect her direction of the body. She was able to touch her finger to her nose and follow objects successfully bilaterally while standing with her eyes closed. Able to touch heel to opposite. Okay, so whenever you're standing here, I'm just going to have you touch your heel to opposite shin here. Okay, so she's able to touch her heel to the opposite shin of her other leg. Perfect. Okay. Now I'm going to have you sit back up on here for me. In order to do her deep tendon reflexes, I won't actually demonstrate the actual movements or anything, but I will show you how it would be done. So in order to test her biceps tendon reflex, I would lightly hold her arm like this, with her arm slightly bent inward like this, and I would strike her biceps tendon right here. So it'd be right next to her, right in the internal side of her arm. To test her triceps tendon reflex, I would bend her arm at a 90-degree angle and just hold it like this, relaxed, and I would strike the area right above her elbow right here, right on her tendon reflex. To test her brachioradialis tendon, I would just hold her arm in my hand like this, and her brachioradialis tendon will be kind of right over the bone of her wrist. So it's kind of right here. So that's exactly where I would strike it. And then in order to test her patellar tendon reflex, I would just have her dangle her legs here, and I would strike right in the center of her kneecap right there. And then in order to test her Achilles tendon reflex, I would lightly hold her foot up like this and strike the back of her heel, or the back of her Achilles with the hammer. So that's how I would do the deep tendon reflexes. Whenever I would assess them, I would expect them to respond whenever I would strike it with the hammer. Now I'm going to be doing the Babinski reflex. So I'm just simply going to take the end of the hammer here and strike it on the lateral side of her foot. And it makes her flare her toes, which is a good sign and is a negative test for the Babinski test. Okay, to officially complete our assessment, we're going to be doing musculoskeletal now. So I'm just going to have you face me, and I'm going to stand back here, and I'm just going to have you walk across to me from heel to toe, like this. Perfect. Nice. Beautiful, thank you. Able to successfully walk across the floor heel to toe. Now I'm going to ask you to walk on your tiptoes, and then walk on your heels. Perfect. Now I'm going to ask you to just stand still and close your eyes. Okay. I'm not noticing any swaying or falling whenever she's standing with her eyes closed. Whenever I lightly push her, she doesn't sway. Her balance is steady. Perfect. Okay, and now we're going to be doing shallow knee bend, which is that, sorry. Okay, so now I'm just going to be testing for a shallow knee bend, so I'm just going to ask you to kind of squat down like that. Perfect. Wonderful. Okay, and now I'm going to just be testing the range of motion with your spine. So if you can just bend over for me like that, and then side to side. Awesome. Okay, she has good range of motion demonstrated to spine. And that completes our assessment.
Thank you so much.
Yes, it was great working with you.
Yeah, you did wonderful.
Thank you.
I feel so assessed.